a Friday afternoon. For the Access Service Confirmation Portal training, this is related to the Electronic Visit Verification Initiative, but it is not about the actual EVV systems. Today, we're going to be talking about a process that's related to authorization for services. So it doesn't relate to the systems that support the recording of the visits, the clock in and clock out, for example. Those are functions that the EVV systems perform. We're going to be talking today about prior authorization. If the services that you provide as a provider generally are prior authorized, meaning that the health plan has to authorize those services before they're performed. Most of this training will not apply to you, but if you do provide services that either sometimes require prior authorization, depending upon the health plan you're contracted with to provide services, or none of the services that you provide require prior authorization, then this training is definitely specific for you. So again, thank you for joining us on a Friday afternoon, and we look forward to your engagement during this training. A little bit about what we are going to cover in the training. We'll do some introductions of individuals, voices that you're going to hear throughout today's webinar. Talk a little bit about housekeeping as far as how we plan to support your engagement webinar. Do an overview around what exactly are we requiring? What is this portal? What is it? How do we use it? When do we use it? What data do we have to submit? We're going to cover all of those questions. We'll also do kind of midway through the webinar today, we'll do an overview of the technical guide. So the guide that walks through the steps of how to use the system and how to access it, as well as do a demonstration of the system. Before we get into your questions, we'll talk about a timeline for compliance. When are you expected to start using this system and program? And then go over some frequently asked questions that we've already received when we've talked about this leading up to these trainings. Talk about those resources and technically use the system and access it and engage with it. And then, of course, we will leave time at the end to talk through your specific questions that you have. So as far as introductions, my name is Sarah Johnson. I'm a Program Development Officer at Access. My colleague today, Julie Nieder, she is the Technical Coordination Unit Manager, and she will be the one showing you the technical guide, walking you through that as well as doing the demonstration. Lauren Petrie is with the Office of Data Analytics. She's the administrator of that office here at Access, and she's our technical advisor and may chime in to help answer some questions or clarification. My colleague Danielle Ashlock is sort of facilitating the Zoom today and will also be assisting with the Q&A portion of the session, as well as you may see some responses from her related to some questions that you're posing. And then last but not least, we have representatives from the various health plans, the Access health plans, which include our managed care organizations, as well as representatives from the Access American Indian Health Plan that provides services on a fee-for-service basis. A little bit of housekeeping. I think we're all pretty much used to engaging in this environment. But just as a reminder, everyone is muted until the end of the presentation. After the presentation, you can raise your hand to ask a question, but actually we would prefer that you type your question in the Q&A or the chat box during the presentation. We will go through and read those at the end and answer those questions if we haven't answered them already through the various team members on the team today that are responding to those questions. If you see another question that somebody else asked, feel free to go ahead and like it. That helps us prioritize questions if we tend to run out of time towards the end of the webinar. Although we've done 2 of these already, and generally the presentation portion is about an hour, and then we have about half an hour or so of questions, and then we're able to wrap up after that. Excuse me. So while this training is not about EVV specifically, how to use the system, and different things of that nature, specific to the recording of the visits, we are going to do a little general overview of EVV because it serves as a foundation for our discussion today around prior authorization. So these are the provider types that need to comply with EVV. If you're listed on here, doesn't necessarily mean you have to do EVV. We need to go and look at what services you're providing, because there's only certain services provided by these entities that require EVV. So in looking at that, there's 2 categories of services that are required for EVV under the CARES Act, the 21st Century CARES Act. One category is personal care services, and the other category of services is home health services. When you look at this list of personal care services, you see some services in there like respite care, like habilitation, which sometimes are skills training and development, which can include some skills support, as well as other activities like supervision under respite care. We came up with this list and determined this list of what constitute personal care services, looking at the CMS guidance that was provided around EVV, looking at our various federal authorities, which are basically our contracts or the permissions were given by the federal government to run our Medicaid program. We have something called a state plan and a waiver. We also conferred with our coding experts and others that are experts in these areas of service delivery, as well as checking with our legal colleagues and our Office of Inspector General. And that's how we came up with this list to determine whether or not EVV is required for these different services. The other category is home health services. These are generally the skilled services that are provided by nurses or home health aides, and sometimes therapists. There's been some confusion around whether or not all therapies are subject to EVV, and the answer to that question is no. Only those therapies that are provided by a licensed home health agency, which is generally licensed by the Centers for Medicare and Medicaid Services and our own Arizona Department of Health Services. After looking at whether or not your provider type is subject to EVV, you look at the services, and if you find that, yes, I in fact provide those services, the next thing you need to look at is where do you provide those services? And if you use the following place of service codes in your claiming and billing for these services, then EVV applies to you. It certainly applies when you're going to the home of a member, and it also applies when you're going to meet a member in the community to provide services. Place of service code 99 generally is the code that is utilized for those types of service delivery scenarios. And then we have assisted living facility. This is not to mean that assisted living facilities are subject to EVV. What this means is that some of the home health services are actually provided in an assisted living facility. The nurse from the home health agency goes to the assisted living to provide services. So that is why we have that place of service code here to represent those situations. So why is the service confirmation portal required? So as I talked about, we're going to walk through a series of slides to discuss what exactly is the service confirmation portal and what it does. Before we get into the details of that, the reason why we're having this training with you today and why something like this is required is that we're required, as you're aware, to comply with the 21st Century CARES Act, specifically for today's topic, the EVV requirements under that act. CMS set forth standards that ensure their monitoring of us to make sure the system is compliant. And so therefore, they've established a certification process, and it's what's called an outcome-based certification. So there's certain things we have to demonstrate to them that our EVV system does in order to make sure it complies not only with their standards, but ultimately the 21st Century Cures Act. And one of those key components is to make sure that our system avoids payment for unauthorized or unapproved services by reconciling or making sure that the linkage between the member, the provider, the services, the units, and the actual EVV visits are all linked up together and reconciled together prior to claims payment. So a key part of this linkage is the authorization. The prior authorization, or what we're talking about today specifically, is what's called service confirmation. So the big thing for you to understand is, as to the why we need to do this, is that the use of the portal is necessary ultimately for you to get paid for services that don't require prior authorization by the health plan. It's a supplement to the current prior authorization process that you use today. And so in order to make sure that those linkages happen in those instances where there is not a requirement for prior authorization by the health plan, we had to create a process to supplement that. And what we call the service confirmation, and then you have to use the service confirmation portal. You may ask, how come we just didn't make it easier and require all services to be prior authorized by the health plan? Well, one of those reasons is that Access gives flexibility to the health plans to establish these prior authorization requirements, which is why, depending upon who you contract with, you may have certain requirements for one health plan and certain requirements for another. Or you may have no prior authorization requirements at all, depending upon who you're contracted with to provide services. So we wanted to continue the MCOs as part of their obligations under managed care to have that flexibility. The other reason, probably the thing that we most can all connect with, is we want to mitigate access to care barriers for members. So for those services that do not require prior authorization, sometimes it's determined one day that a service is needed, and then the service is actually provided the next day. For those services that do require prior authorization, oftentimes that authorization period can be anywhere from a few days to a couple of weeks. And so for those service delivery providers and members who are getting these services that don't require prior authorization, we wanted to mitigate, or we didn't want to create additional barriers for them to get care. So when is this required? We'll talk about in a minute what exactly this is and what it looks like and what data is required. But before we do that, let's talk about a couple of scenarios. If a service subject to EVV already requires prior authorization by a health plan, there is no change to that health plan's process. You continue to do what you've always done. You follow the health plan's specific requirements for prior authorization and their process. Nothing changes. You can stop there. If a service that requires EVV does not require prior authorization by the health plan, you will need to use what's called the Access Service Confirmation Portal. This notifies the health plan of your intention to provide a new service or continue to provide an existing service to a member. Here's another example, a little bit more specific. The provider, you, contracts with both Health Plan A and Health Plan B for skills training and development. Health Plan A requires prior authorization for the service. So You just follow through the same process that you've been doing to request prior authorization, and you follow that process for Health Plan A. Nothing new to do at this point. You have a different member who's enrolled in Health Plan B, who you're also contracted with. And that Health Plan B, does not require prior authorization for the service. It's the same service, but two different sets of rules. So in that case, the provider will use the Access Service Confirmation Portal to self-authorize or notify the intent to provide a service for members enrolled in Health Plan B who are getting the skills training and development service. Here's another way to look at it, and I'm probably going to sound like a broken record throughout today's session, and I do apologize for that in some ways, but we just want to be very clear about when you follow what process, because we don't want to duplicate. It would be very problematic, just as problematic, not to follow each separate process as it would be to do both processes at the same time. So it's very important that we do not duplicate this process. So in those cases, again, where the health plan requires prior authorization, you follow through on their process. You do not enter any information into the service confirmation portal. Sometimes we have folks who are overachievers, and so they think more is better. In this case, that's not the case. We only want you to be using the service confirmation portal when prior authorization is not required by the health plan. So in this essence, you're self-authorizing a service. You enter the data elements and you'll receive a reference number for your own purposes. This data from both processes, whether it's prior authorization or the service confirmation portal, gets integrated into what's called the authorization file. The health plan will have, each health plan will have an authorization file that gets sent to SanData. And in this case, we're not talking about the SanData EVV system. We're talking about SanData as their function as an aggregator. So this information gets put into what's called the aggregator and helps link the member to the provider, to the services, and to the visit data, which all supports claims payment. Because we can't, under the Cures Act and under the CMS certification requirements, pay for a visit for an EVV service unless all of these things, all of this data is lined up. So again, it's critical to your efforts to make sure to mitigate any claims issues by following this process. So what are those required data elements? Well, looking at these, those of you who are used to the authorization process, a lot of this information is generally considered in an authorization, which is kind of why we talk about this process as being a self-authorization process. You have the Medicaid member, access ID. You have the access provider ID. As part of this, you include the begin date and the end date of service. And we'll talk a little bit in the coming slides about do you do a monthly service confirmation? Do you do a quarterly and annually? We'll talk about that. You include the activity code, the service code, how many units you expect to provide, and any modifiers. The modifier is an optional field, so it doesn't have to be included, but it's optional. Then there's something that you probably haven't recognized before, which is the medical necessity determination date. And this is a data element that you need to enter into the service confirmation only when you are providing a new service to a member. you've been providing skills training and development and personal care to me for the last 6 months. You do an assessment, maybe the treatment team meets or the service planning team. You decide, oh, my family could also benefit from respite care. At the point that you decide to provide the respite care, you'll need to do a service confirmation, and that's when you enter in the medical necessity determination date. The reason why we're asking for this is because it helps support our planning, both access and the health plan, to determine whether or not we have an adequate network, meaning we have enough providers to provide services. And it also helps us understand, do we have enough people? So our workforce development monitoring, do we provide the service? These are key points to helping us measure access to care for members. With this data element, we'll be able to track at the access level and at the health plan level whether or not members are getting services within a reasonable amount of time. And the thresholds that we've used to determine what's a reasonable amount of time is 30 days of enrollment for new members. So once a member's enrolled with a health plan, we want to make sure that they're getting any medically necessary services within 30 days. Or if it's a member that's an existing enrolled member in a health plan, and going back to my scenario before, it was decided, oh, Dara needs respite care. We want to make sure that that respite care is provided within 14 days. Generally, you don't have to worry about the medical necessity determination date, because for those services that do require prior authorization, the health plan is going to provide that to us. But for the services that do not require prior authorization and you're using the service confirmation portal, you will be asked to submit that date when it's appropriate for only new services provided to a member. Here's a little chart as to how we've, Here's a little chart as to how we've defined and looked at what is that date that we're going to look at? How do we define when medical necessity was determined? So when we talk about EVV services, there's really, outside of the personal care and the home health care categories under the Cures Act, when you look at actually the services in general, there's kind of three general categories. One being the all-text category, things like attendant care, companion care, habilitation, respite. There's the home health services, nursing, the various therapies, home health aid, and then there's behavioral health services, personal care respite, which are also shared by the all-text program, and then something called skills training and development. So when we looked at these, we went, when is medical necessity determined? For all-text services, that's generally determined during the person-centered service planning meetings, so the team meetings, right? Sometimes a health plan may have policies in place that require maybe a secondary review at the health plan level. And in that case, that would be the date of medical necessity determination. For home health services, generally, they require prior authorization. So this would be the date that the MCO or the health plan approves the prior authorization request. For the category of behavioral health services, these generally do not require prior authorization. So again, they would necessitate the use of the service confirmation portal. And only for new services would you add the medical necessity determination date. And we've defined that date as the date the treatment team or the provider decides the member needs the service. So it could be in multiple things, including maybe an assessment or a conversation or all kinds of things that could inform that process to determine, yep, it's medically necessary for Dara to get respite, for example. So just clarifying that there's sometimes been some confusion around this, and certainly understandable because it's new, that the medical necessity determination date, it's an optional field in the portal, which means that it's only required for new services. It's not required when you're entering in or you're modifying a service confirmation where you're increasing or decreasing service hours, not needed because it's not a new service, or maybe there's a change in authorization because the provider needed to change, but it was an existing service. So if you're a provider who receives a member or is referred for a member who is getting a service by another provider, you wouldn't need to enter in that date here because it's an existing service. If you don't know, then you would include it. I understand this chart is hard to see, and we are going to, when we post the PowerPoint, which we'll talk towards the end of the session about where it's going to be located and when we'll be posting it, we'll put this in a separate document for you so you can see it better and larger. But essentially, we created a workflow for you as to how this process works. And up in the top left-hand corner is the member. So we walk through the fact that, hey, there's a member who's either getting or needs an EVV service. You confirm under the second line. Most of the year is your obligation, as you can see. You decide or you confirm the member's health plan enrollment, who they're enrolled with. You confirm whether or not that health plan is has a prior authorization requirement for that service. If yes, then you kind of go down to the bottom and you see that you follow the health plan's process. They have an opportunity to make a decision about the prior authorization, and then the process ends. All the way it happens today. If prior authorization is not required, that's where you see the longer stream here to the middle and to the left of the page, or to the right of the page, excuse me. So you're going to use the Access Confirmation Portal. Is it a new service? No, then you just enter in all the required data elements minus the medical necessity determination date. If it is required, then you enter in that date along with the other required elements. The system, once you enter in that information, as will be demonstrated today, you'll get a confirmation number, and we certainly encourage you to keep that number handy, as well as the portal itself will have a history of that information. So we thought it just might be helpful to put a visual together, and again, we'll post this to the website for you to access as reference material after today's session. I am going to transition now, and we are going to transition to a review of the companion guide and a demonstration of the portal, and I'm going to hand it off to my colleague, Julie. I'm going to stop sharing, Julie, so you can continue.
Okay, can you hear me okay?
Yes, ma'am.
Thank you. Now let me share my screen. Wonderful. And you can see my screen. Well, good afternoon, everyone. As Sarah said, my name is Julie Nieder, and I'm going to walk you through the EVV Service Confirmation Portal User Manual and then do a demonstration of the portal itself. As Dara mentioned earlier, the reason why we are doing the authorizations and thus creating the EVV Service Confirmation Portal, I am not going to repeat that at this point in time. However, how to obtain the access to the portal. This is based on already having security to the Access Online portal. And once you have security to the Access Online website portal, the security for the EVV service confirmation portal is another layer to that. So in order to obtain that security, you must be one of the provider types that Dara mentioned earlier, and on the next page, I also have a list of the provider types. And the master account holder will have the ability to grant the security to this EVV service confirmation portal, which is again through the Access Online website. So as you can see, here's an example of what the menu will look like. So once you receive the access in your menu that you see currently today, you will have a new selection called EVV Service Confirmation. And I did put in here for you how to obtain the general access, security access to the Access Online portal, if you do not already have that. So that is in here, the phone number and the link. And then here are the provider types. So if you are one of these provider types, then you can get access to the EVV service confirmation portal. If you are not one of these provider types, you will not be able to get security access. Then we also have the service activity codes and the place of service, which Dara also mentioned earlier in the presentation. So once you select the link on your menu, on your main menu, in the Access Online portal of EVV Service Confirmation, it'll bring you to a main screen called the Service Record Search. Here you can search and you can enter in a new authorization. This is where you would manually enter in each authorization per member. So to manually enter in a new authorization, you will click the New button, and it will bring you into the service record where the required fields are needed to be entered. So you will enter in your access ID. That's the access ID of the member, and that is the A number followed by the 9 numeric value. You will select the service provider ID, and in the drop-down here, the providers that are part of under the master account will display. So I'm going to scroll right back up to the security, excuse me. So if let me read right here, for provider types permitted to use the portal, the account administrator will have the ability to grant the system access to the users. And then again, if the provider is not permitted to use the EVV service confirmation, then you will not be able to see it. Users who have been granted access to the EVV service confirmation portal, you will log into the Access Online website and you will see the options. Those providers, you will see the EVV option under the main menu. Again, if you have several providers under that account, you will see the listing of provider IDs. And I'm going to scroll back down in this selection here. Begin date of service, end date of service. Those have a specific format that need to be followed, which you will see right here on the service record page. Units. Units currently, as I do the demonstration, is not required. However, when we do go live, that will be required. Activity code. Modifiers, you have up to 4 you can enter in for modifiers, and then the medical necessity determination date based on the business rules that were previously explained. Once you enter in that information, you will click the Next button. And if any of the information is incorrect, you will get error messages. So for example, there's 2 examples in here of error messages for you. If the format of the date is not correct, you will receive an error message telling you what the format needs to be and gives you the opportunity to correct it. And here's another one where the end date of service cannot be before the begin date of service. Again, it gives you the opportunity to correct it. Once you have corrected all of the values, you will click Next, and you will receive a service record confirmation page. This is where you have the opportunity to do one last verification, ensure everything's accurate. If it is not, you may click the Edit button and then make your changes appropriately. If everything is accurate, then you will click the Submit button. Once you click Submit, you will receive a message saying record added successfully. You will get an authorization reference number. That is the number Dara mentioned earlier that you want to log. This will be unique for the authorization for the member. So that's how you would enter in manually record by record. We do have a way for you to do a bulk file upload. So when you come in, again, to the EVV service confirmation screen, on the main screen, you will see the option that says Upload File. Once you select that, it will bring you into the EVV file upload screen. Here, you have the ability to browse your drives for the file. You can upload the CVS file. And you also have the option to click on the help. The help is a show high collapsible help information, and that provides you the information on what the file layout needs to be. The file type, the information, the file size. So all that information is in the help button right there on the screen for you. So once you're ready to upload the file, as I explained, you will click Browse, you'll grab the file from your directory and then you will click Upload CVS File. At that point, if the file is valid and it passes all of the edits, then you will have a successful transmission, and this is the ending results you will see. Again, you will see the authorization reference number. That is the number to log. And then status of approved, the member's access ID, the service provider's ID number, your begin and end dates of service, your units, activity code, modifiers up to 4, and then the medically necessity determination date if it was applicable, and then the date of the submission. If the file has any errors, you will receive this. It'll tell you there are errors. It will tell you what row on the file has the errors that need to be corrected. The entire file is rejected. So all errors on that file need to be corrected in order for the file to upload successfully. Once you correct all of your errors on your file, then you upload again, you browse your directory, you get the file, you click Upload, and if it passes all the edits, you will end up with getting the successfully submitted message. We are providing the opportunity to test a file if you would like, where it would be a small file that you could send over to me, and I will test it in the test system and provide you feedback of approval or if any changes need to be applied to that file. So we are providing you that opportunity if you would like to take advantage of it. And with that, and this is just showing you're successful again. So then when you do a search, I'm going to come all the way down to the search. So back on the main screen where you had search and you had new, you can do a search. You can do a search on the provider. The service provider ID is always required. So you can do a search on the service provider ID and get the results of every authorization that you have uploaded. And you will have all the authorization reference numbers, again, your status, the access ID of the member, the service provider ID, the the provider type, begin and end dates of service, the units, activity code, the modifiers, the medically necessity determination date, and the date you submitted the information. If you want to drill down and make the results smaller, you can do it by member by putting in the access ID and the provider again, the service provider ID, and just those results will be returned for that member. If you want to see everything you submitted based on date of service, again, all you have to do is put in the date of service then, along with the provider ID, and you will return those results of just that date of service. So you can drill down on your search results. So with that, I am now going to do a demonstration for you. So this may look familiar to everybody. This is the Access Online portal. Again, you have to have the security for the Access Online portal in order to obtain the security for the EVV service confirmation portal. What you are going to see is a test region of this portal, and I am utilizing a test provider and test members. So my security is going to be limited in what you see in my menu. So you put in your username and your password. And once you, like I said, once you obtain the security to the EVV service confirmation portal, that selection will appear in your menu. You probably have many different options here listed in your menu. Again, my security is only limited to the EVV service confirmation portal at this time. So you will select that from your menu, and here's the main screen. Here is your search and your new. And if you want to do your authorizations manually, you will select new and do them individually. You want to do the bulk upload, you will click upload file. I will be showing you both methods. And then if you want to do your search to see your results, you would click the search. So at this time, we are going to manually enter in an authorization. So I am going to select new, which is going to bring me into the data entry screen. Here, I need to place in my member's access ID, select my provider, and I'm the only one out here because that's the only security I have. And then I'm going to put in the begin date of service, and I'm going to place in the end date of service. I'm going to place in the units for the activity code, how many units I can put in. It has a limit of 999,999. I am sure, and Dara will be speaking to this after the demonstration, we do not want you just to place in that number. We want you to put in the units appropriate for the time frame and for the activity code. You select your service, your service code here, the activity code. If there's any modifiers to be applied, please key those in. That is an optional field, but we do want you to put them in if they apply. And then the medical necessity determination date based on the business rules Dara already walked us through. At this point, you will click Next. If I had any errors, the errors would have displayed. If I keyed the member's access ID number incorrectly, it would have displayed. If I keyed any of the other data elements incorrectly, it would have stopped me. So again, to give you the opportunity to make those corrections and then click Next. At this point, you are confirming if this information is accurate. If it is not, you will click Edit. It will bring you right back to the same data entry screen. If you review it and you say it's good to go, Now you will click the Submit button, which now provides to you the confirmation information. Here's the authorization reference number. That is the number that Dara was explaining earlier to log. Tells you this record has been successfully submitted. And there's all your data. If you want to do another one manually, you will click New. At this point, I'm going to show you how to do the file upload. I'm having a thought that most of you would probably be doing a file upload with many members and services. So you click the file upload selection button link that was right here. And at this point, I do have the files already, and they're in my directory. So I will show you what a good file is going to look like. This is a valid file, and according to the help, the file format, this is what it would look like. So I'm now going to choose the file off of my directory. And at first I'm going to upload an invalid file to show you the errors. So I selected the file. I'm going to upload CVS file. It's going through the edits, and it now has come back to say, oh, you have 4 rows of data that has errors. So each one of my rows, and on my invalid file I had 4 rows, each one has an error. All of these errors must be corrected in order to upload the file. Again, the entire file has been rejected. So in order for the file to be submitted, all errors must be corrected. So I'm going to go and I'm going to correct my errors. And after I correct my errors, I am now going to go choose my good file with all my errors corrected. I'm going to then click Upload CVS File. The file EVV Service Confirmation Portal Valid File was uploaded. So it's telling me it was uploaded. As you can see, you can start seeing my information displayed down here of what was uploaded. So here I had 3 rows of data, as I showed you, the access IDs, the service provider ID, the begin data service, end data service, units, activity code, my service code, my modifiers, and then the medical necessity determination date if it's applicable. Then you click Submit. Once you click Submit, you will get the authorization reference number. Again, that's the number to log. And then you will see status A is approved, and then the rest of our data. Now I'm going to go back to the main screen, and I am going to show you the search so that you can see all of the authorization numbers. So again, you want to see everything for your provider, you just select your provider ID and click Search. These are all the either manually loaded or using the upload file process of authorizations that I have done. So here you can see all the authorization reference numbers. You can see the status approved, the access IDs, the service provider ID, the service provider type, my begin and end dates of service, and the units. I want you to note here, you're going to see right now during this testing, the units of 0. You will not see that once we go live because units are going to be required. This was when we did not place any units into the upload, into either manually uploading or the file. So you will not see a 0 in the units because that is going to be a required field when this goes live. Your activity code, your modifiers, you can have up to 4, medical necessity determination date, and then again the date, the submission date, the date you submitted the record. that is the demonstration for the EVV, Service Confirmation Portal.
Okay, Julie, before you logged out of the screen, we had a couple questions about submitting test files, CSV test files, and I think we talked about that the other day. Refresh my memory that we were going to check to see if that was available or not, and include that in our FAQs, correct?
So I've actually added it to the manual. The test system is not available to external customers. It is only available to internal. So in order to help with testing of a file, we have provided the opportunity for the providers, if they want to test to ensure their file is in compliance for smooth processing, they can actually email it to me. I will put it through the test system, and I will provide the feedback back to the provider. This should be a small sample. What you are doing is you're testing to ensure you have the file layout correct. This should not be a large file. The file size maximum is 500 records. This should be, like I just uploaded 3. There should be a small subset of records to ensure the comma delimited file is compliant.
But essentially, Julie, so thank you for offering your services, but essentially the process you showed us, it will tell you if the file is not correct, if there's something that's not correct. So you kind of self-test it in that sense as well, right? In showing that it'll tell you what's not correct if you put in an invalid file. Or correct. Invalid data, I should say.
That is correct, and it will tell you what, it will provide you the error message and what needs to be corrected. So that is accurate, Dara.
Okay, thank you.
You're welcome. Any other questions while we're on here?
I think I don't see anything specific to that, and so we'll get to the ones a little bit later. We just have a few more slides to get through.
Okay. I will stop sharing so you can share.
Thank you.
You're welcome.
Okay. Julie or Danielle, can you confirm you're seeing the PowerPoint again?
Yep, we can see it.
Okay, great. Okay. So a couple of more slides before we then go into some of your questions that you're asking. You guys are asking really good questions. And those questions, just so you know, are going to be used to inform an FAQ document that we will post along with the materials from today's session. So when do you need to start using the portal? So let's talk about mandatory use first, which is the second bullet here. EVV is required for services beginning 1/1/21 moving forward. So if you're providing services to members that do not require prior authorization, all of those members need to have service confirmations in the portal for dates of service beginning January 1st. It's not just for new people. It's for any existing members you have that you're planning to serve on January 1st and moving forward, whether they're an existing member or a new member that comes to you after that period. Service confirmations need to be in the system beginning January 1st. The portal is live right now. We're still waiting on a few updates, one being the item that Julie just talked about with where the units are required, will be required. And another one we'll talk about in a second. But so you can technically start using the system, and we would encourage you to start using the system early on for dates of service beginning January 1st, 2021. Technically, you could do a soft launch of this system. Some of you using the SAN data system will be getting your welcome kits very soon. We continue to work on that. It's a very high priority for us. As soon as you get those welcome kits, if you have members that are not, that you're providing services to that do not require prior authorization, you will not see those members preloaded into your SAN data account until you enter in the service confirmation. So if you want to try to use and play around with EVV before December 31st, you'll need to enter in a service confirmation for dates of service between now and December 31st. That's not required, but we do suggest everybody start to work on loading the service confirmations for dates of service beginning January 1st. Couple of frequently asked questions. Is there a manual upload or an upload function? Yes, obviously, Julie just demoed that. When does the service confirmation need to be in the system to ensure compliance with EVV? Ideally, you want the service confirmation in or entered before rendering the service. We do have a FAQ that we'll follow up with to make sure that, I believe, as long as the service confirmation is entered before you bill for the service, we're also okay with that as well. But it does have to be there before you bill for the service. So we just need to check a few things to double check that. You can enter in up to 4 modifiers. I do think there was a question about, well, what if you have more than 4? And given that this is an optional field, I think our guidance would be you enter in as many as you can. And then, of course, you include the appropriate modifiers as part of your billing. The claims validation does not check modifiers. So there's not going to be an issue with claims validation if you don't have all the modifiers in the service confirmation that you may have on a claim, for example. What is the maximum number of units? So Julie showed you that you can put in 900,999 units into the system. So almost 1 million units you can put in. Certainly we don't recommend, and we'll actually be monitoring for this. We want you to put in the appropriate amount of units based upon what you anticipate the need, what you're planning to be the need of the member. And that should be based upon their service or treatment plan. This also coincides with what cycle should you use. You can do up to a year, a service confirmation for up to a year. That would make sense if you have a member you've been serving ongoing and their service delivery patterns have been pretty consistent. So you could do a year. We would recommend you do it based upon the review cycles of their service or treatment plan. So if you're doing a monthly review, then I would put in a monthly service confirmation. If you're doing them quarterly, every 90 days, or if they seem to be somebody who's stabilized as far as the service needs are stabilized, then you could do up to a year. It's pretty much up to you what you would prefer to do. So how can you update a service confirmation if more units need to be added? So this is something we are currently working on now with the system. It'll be available 1/1/21. We don't know exactly what that will look like. We will come out with an update to the technical guide, as well as we'll send out a notice with an update on that. But in the interim, if you want to get in there and start using it, and you put in a service confirmation and realize between now and December 31st that you need to add additional units, just submit a new one that adds in those additional units, and it'll just act as a supplement to the one that you already put in there. But again, we'll have some functionality in place to support those scenarios in the future. So where do I go to find out how many units are remaining for a service confirmation or a self-authorization? So if you're using the SAN data system, within the portal, you'll be able to view all the authorizations, both the official prior authorizations and those that are service confirmations that you put into the access portal. If you're using an alternate system, you will need to consult with your vendor to see if they have the functionality to report this information. One of the main questions, which is certainly a very fair question, is whether or not this process will create additional delay for the health plans as far as their process for approving claims for payment. So we do not anticipate this to cause any delay in payment. This data, to just clarify again how this works ultimately with claims validation, this data gets integrated into an authorization file that gets sent to SAN data nightly. The data helps link the provider member, the services, and the visit data to support the claims payment. So the health plans do not have any new processes for claims validation or claims processing, but they do have additional edit checks, which are those things that are required by CMS. So again, it's not a new process for them, but there is additional information that is checked. And that is a pretty automated process. And those things are being tested and worked out now. So again, we do not anticipate any delays. If for some reason you experience something differently with claims and payment than you did before EVV. Now, of course, there's things you're going to experience differently. During the soft edit claims period, that January through March 31st timeline, you're going to get claims remits that tell you, hey, there was something wrong here with the information that we needed for the claims validation process. We paid it anyway, but here are some things are missing information. So you're going to get those notices, and that's to support you to know where your weaknesses are so you can correct those so you don't have a claims payment issue when those hard edits come in beginning April 1st. But outside of that, we do not anticipate any issues occurring. If in fact you do experience, I guess, issues, we want you to share that information with us. We're going to be monitoring this process in collaboration with the health plans to make sure that EVV in general just does not create a payment issue. And we're mitigating those issues up front by some of the work that we're doing here today with you, and some of our other education efforts and our testing that we're undertaking currently with the health plans. So before we get to questions, I just want to highlight that if you're not familiar with the Access EVV webpage, you should be familiar. So definitely go in there. There's lots of information. We are adding information regularly. Next week, we have more training on Monday. And after that, early next week, we'll be posting. So hopefully when you get back from your Thanksgiving break, we'll have the session PowerPoint and recording online, as well as a companion guide that Julie walked through earlier, as well as an FAQ document, so that we can provide that to you based upon the questions that you've asked today. If you have general EVV questions, so less about authorizations and more questions about education, outreach, training, policy, those kinds of things, please email them to us at evv@azaccess.gov. Danielle and I answer those emails directly, and we answer them all day. So generally you get a response to us from the same day, if not within hours or even minutes of your email. We are trying to be very supportive of you and answering your questions. Related specifically to the service confirmation portal, Julie and Lori have offered their support if you have troubleshooting issues. So in general, if you have technical issues or questions about access to the Access Online portal, the main portal, you need to submit those to our ISV customer support or give them a call. If you're having issues with the service confirmation portal itself, so the information and the portal that we reviewed today, we ask that you email Julie, Lori, and evv@azaccess.gov all at the same time, copy all of us, so that we can determine if there is an issue or if the system issue, or if it's a matter of supporting you, where to point you in the guide. We do recommend that you always review the guide before you submit any questions. That's what we're going to refer you back to with any questions. So definitely please review that. And then anything you can't find or something you're experiencing, please email us so we can support you. One other resource, somebody had asked the question about where do we go to find out the health plan requirements. So with the posting of the PowerPoint, we will be listing all of the links to the health plan websites where we cover prior authorization requirements. So you do not need to, you don't have to look in multiple places. You can come right here to and look at your health plans that you're contracted with and identify what applies to them. So with that, excuse me, we will go to your questions. I'm going to pull up the list here. Sylvia asked, so in our case currently, if the next authorization has not been received, we continue to provide services to the member. We can't bill for services until we receive that authorization with EVV. Do we hold that information until we do receive the authorization from the MCO? So this is a case where you do have to do prior authorization. One of the benefits of EVV is that we can track this a little bit better. We can track the timeliness of authorizations for those services that require prior authorization. So with the EVV, and you cannot bill for a service unless you have the authorization. So hopefully that answers your question. This is one of the other things that we also want to have you inform us about, that if you're seeing late authorizations or if you're experiencing a different pattern than what you have before, we definitely want to know about that so we can get to the root cause of that issue. So James asks, so is it accurate to say that if we are already providing this service, we do not need to self-authorize using the service confirmation portal? No, James, that's not accurate. Beginning 1/1, you need to have a service confirmation portal for every member who are enrolled in a health plan that does not require prior authorization for that service. We have to have an active authorization, prior authorization, or service confirmation portal, or service confirmation for members beginning 1/1. Good question, though. You're thinking along the right lines. Sarah asked today, if I have a client today I'm providing respite for on January 1, do I need to put the information into the portal and consider it a new service? It is not a new service. So you don't need to include that medical necessity determination date, but you do need to add them to the portal. So Ariel has a question, Julie, for you. Are you able to download the approved uploaded file with the auth number approvals? Can you download that file, or is it just a matter, Julie, where you can see those auth numbers via your portal access?
You can see the auth numbers via the portal access. You cannot download that. You can, I played around with it yesterday because we had a question yesterday about if you could print. I have a question out to our developer on that. However, you can right-click, so you can be on the search screen and right-click and print. You can also, if you have a snipping tool, you can use that. Some of the tools that come along with the new Windows. But right now, you cannot upload that authorization file. You can just see them on the portal.
Thank you, Julie.
You are welcome.
So Jessica says, we use a third party for EVV that our patients will be loaded through. Will that meet the requirements of adding patients into Access directly, or do we need to enter the patients into both? So number one, this portal is not the EVV system. You do not, you're either going to, you have to either follow one of two processes, and let me refer back to one of the previous slides here. Just give me a second, because I think this will help. So here's an example of, it's either one process or the other. You either, if the health plan requires prior authorization, you follow their process, or if the health plan does not require prior authorization, you use the service confirmation portal. The files then get combined together into the authorization file, and if you're using the SAN data system, you get access to that information. I don't know how the third-party systems work, and whether or not they load authorizations from the health plans. So that would be a question to ask your vendor. Okay, I'm just here. So will respite, attendant care, and habilitation service units be based off their yearly ISP or the 90-day review? So Asbel, I think that's how you say your name. If my understanding is those services are generally prior authorized, so those services do not require the use of the service confirmation portal. Okay, so Dan asks, for members that are currently in program that will be there in 1/1, will the medical necessity determination date be needed? No. If so, we use the original date, or yeah, it's not needed. It's only needed if you have either an existing member who starts a new service, or somebody comes to you that's new and you start a service. Okay, I'm sorry, I'm just scrolling here. So can you use an example demonstrating the attendant care services provided to the member? So again, attendant care, if not all the time, is generally requires prior authorization. So the service confirmation portal would not apply in that case. So when you say units, in quotes, are you referring to the number of services provided in that time frame, or are you referring to billable units? For example, one service that occurs for 1 hour, it's the billable units. Good question. For an independent provider, please explain the EVV process. So, sorry, my screen is jumping around here. As an independent provider, you need to consult with DDD in regards to how EVV is going to work for you with your relationship with the fiscal intermediary. I am assuming a case manager informs a provider of the new service when needed. It depends on the system, Richie. If it's all text, that scenario applies, and in that case, the service is prior authorized. So it just kind of depends on what maybe vantage point you're coming from. I'm making an assumption you're talking about all text services. Okay, Sylvia, still not clear. We currently have many instances where the auth is not received until 2 or 3 weeks after the start date. How will that impact reporting services through EVV? So one thing is we're going to be able to monitor this a little bit more closely because of EVV and hold the health plans accountable to provide timely authorizations. It's the same as it is today, and somebody on the phone, correct me if I'm wrong, like Lori, if you're on. But as today, you cannot bill for a service unless you have an authorization. So nothing really changes. It's unfortunate when that happens, and we definitely do want to know about that, but we're also going to be tracking and monitoring this. And with EVV, it makes it a little bit easier for us to do so. Alana asks, what if their start date is before 2020? We can still input that, correct? I'm not exactly sure, Alana, what your question is. So can you please resubmit your question with a little bit more clarity? I just want to make sure I understand what you're asking. Okay. So Russ says, can you please go back to the screen showing all text versus behavioral health? So sure, let me do that. Okay, what's here? Sorry, everyone. So I think this is the screen you're referring to. So the only for the screen is to show kind of when, if you're having to use the service confirmation portal, when it's likely you may have to include the medical necessity determination date. So these are just kind of the 3 categories of services that sort of just organically formed when we had to determine what services apply for EVV. So there are some behavioral health services that are, that all text and, I'm sorry, let me say it again. There are some services that are both offered under the benefit, under the healthcare benefit under the all text program, and some offered under the behavioral health benefit package. Personal care and respite being the 2 that are the 2 common things. Okay, I'm just going back up and seeing the questions. I think that is all the questions at this point. I'll just wait a second to make sure there aren't any more. Clarifying speech, occupational physical therapy. This is used for home health only, not clinic-based, correct? Okay. Thank you, everyone. We appreciate great questions. Some of them we're going to include in the FAQ because I think you guys are definitely tracking what we're needing you to do and what we're asking you to do. So great questions. Appreciate your time this afternoon. Friday, enjoy your weekend, and I hope that you all have a good Thanksgiving, wherever that will be, or with how many people that will be. We hope that you have a nice Thanksgiving, and again, thank you for your time and collaboration, and have a good weekend, everyone.